Start our second session, Protecting Family Health and the Environment. We have a slight change in scheduling. Since our first speaker is not here, we're going to start with our second speaker, who is Dr. Emanuela Taioli. She is the director of the Institute for Translational Epidemiology, a professor in population health, science, and policy at the Icahn School of Medicine at Mount Sinai, New York. Prior to joining the school, Dr. Taioli was the chief of epidemiology for the Northwell Health Systems at Hofstra School of Medicine. She has worked extensively on human health disparities, access to care in minority populations, and chronic diseases prevention in the underserved. Please welcome Dr. Taioli.
Thank you. Thank you for inviting me. I'm an epidemiologist, so in a way, it's true we do correlations, but on the other side, we are lucky enough to see things in a more global view. I'm going to give you first a little bit of my experience because I was on the scientific advisory of EPA for reevaluating glyphosate carcinogenicity. Which was interesting. And interesting because I've done other EPA's evaluation and were in general very boring. This was really exciting. It was very, a very interesting experience. And so I thought that it would be good to look at why IARC and other agencies came up with different conclusions first. The first thing is that IARC puts together a panel of experts, looks at animal, in vitro, and human studies, and then these experts vote on the carcinogenicity and the level of carcinogenicity, and there has to be a consensus or a minority position and a majority position. That's not how the EPA works, for example. The EPA hires a panel of scientific advisory, so people who are expert in the area, again, in vitro studies, animal studies, human studies, like I was one of those. But these experts are just giving advice, and then EPA makes the decision. So the experts don't have a power of making a decision, such as is with IARC. Now, the question that IARC was answering is what is the potential to cause cancer in humans? The EPA was just evaluating whether there was a risk of carcinogenicity in the product. So these are two different approaches to the problem. Now, as a conclusion, well, one thing I didn't add here is that it's true that everybody has availability of the same literature, but there are different ways and different approaches between IARC and EPA. So the IARC decided to use only published literature that was reviewed and published on Medline and on the databases that are recognized by the scientific community. The EPA has used both the published data and the registration data from Monsanto. So the data from the registration are not necessarily published. They are accepted for registration, and a lot of the safety data are those data. So the reason for the EPA is that the data for registration are generated under very strict control of the EPA, so they trust that things are done in an appropriate way. The reasoning of the IARC is that scientific community usually only looks at peer-reviewed scientific publications. That's what we do when we advance the field. We just look at what is published in the literature and peer-reviewed. Now, the end of the story is that IARC closed the meeting saying that glyphosate was 2A, as you heard from Icahn before. So there was sufficient evidence in animals, limited in humans, but strong evidence of mechanism of carcinogenicity. So they thought that there were signs of oxidative damage, of damage to the cells. The EPA went a little bit through a different process. In 1985, classifies as possible human carcinogen. In 86, as not really classifiable. In 91, as non-carcinogen. So it went kind of the other way around. And the last meeting I was at in 2016 came to the same conclusion, basically, that it's probably not a carcinogen. Now, what I want to show you is what we did, because after I left the meeting and other people who were at the meeting, we found that it was bizarre that there is such a little amount of literature on glyphosate that we thought there was something that maybe we couldn't see at the time. So we said, okay, let's go through and review again all the literature that is available. So we put together a review of the urinary levels, which you saw a piece before from Gia, who stole my slide. So myself, Dr. Zhang and Dr. Shepard were on the EPA advisory, so we reviewed again. And so this doesn't really matter. That's how we came down to the number of articles. But the real important thing is that there are only 19 articles, you see at the end, that report levels of glyphosate either in workers or in humans, which is really a narrow number of studies. This is what you saw before from Gia. There are 14 studies on humans. And as you, on environmental, so people like us who are just going around minding our business. And, oh, sorry, this is the occupational, sorry. This, I just went on, okay. So there are 14 studies, 3,000, a little bit over 3,000 subjects tested all over the world. So it's really very little if you think about. And urine samples, 11 studies. One was on milk and urine, and 2 on serum and umbilical cord from mothers and kids. And what you see here, you saw before this slide, what is really interesting in our view is that the studies on children are the little triangles. So there are 2. It's the third and then a little bit towards the end here. So those are the only studies on levels in urine of children. And in general, there is a lot of variability. If you see the dot and the triangle, that's the mean value in the urine. Those lines are the variation of the level. So there are people who can go up as much as 12 micrograms per liter. So there is a lot of variability. It means the exposure, it's very different and very variable across people. When we asked about this at the EPA meeting, so Monsanto was there, and they said that the lack of studies is because there is really nothing to see, so there's no point in doing studies, which I thought was an interesting answer. And that actually one of the farmers said that they drink a glyphosate. Yeah. Right, so I didn't know that. Okay, anyway. So these are the occupational setting. So there are 8 studies, which is really 423 subjects. These are people who spray and use the products. And as you see, we had to use 2 scales because some of the values are really very high. But the point is that, again, there's a lot of variability. Those lines are how much the values can vary. There is only one study, the triangle, on children who live on the farms where the spraying happens. And you see the levels are pretty high and pretty variable. And what is missing, and again, this is very strange, is when we do this kind of studies, usually we start from workers who manufacture the product, and then workers who use the products, which are this, and then the general population. So as you see here, we have the workers who use the product, the general population. We don't have anything of people who manufacture the product, which must be somewhere because somebody must pack all this stuff. And again, the data apparently are not available because they're like internal data to the factory and then therefore cannot be released. That's what Monsanto said. So I don't know. Anyway, we don't have that other piece, which would be really interesting. Now, the other thing that Gia has briefly mentioned is the time trends, so the changes over time. So there are only 2 studies that looked at time trends of exposure. One was done in the US and another one was done in Germany, where Bayer is, by the way. As you may know, Bayer has both Roundup from Monsanto for $60 billion. So that's why there is so much controversy, because of a lot of money. If you look at the US study, the mean level of glyphosate in the urine have gone up from 93 to 2016. They were 0.02 microgram per liter. They're now 0.3, so it's like a 10 times higher. In Germany, they look at changes in percentage of people with detectable level, and those percentages went from 10% of the population in 2001 to 56% in 2013. So clearly, all of us we are all going up in exposure and people who are exposed. And here I just try to represent the percent of people that have detectable glyphosate in the urine. And you see the bottom dot, the blue one, is in the 90s or early 2000. The top is the 2014. So it's really a big, many more people are exposed. Now, so what I really think it's important is there is a lot of gaps in the literature in looking at what is the potential of occupational environmental exposure. There are no seasonal data because these things may change between summer and winter, for example. We don't know. The few data we have is US and Europe. We don't know almost anything from South America and Asia, where these things are used very heavily. We don't have anything on workers involved in manufacturing and processing. In children, we have very little on time trend, and there is a lot of variability in exposure levels. We don't know why. So this is just about exposure, which we thought was like a little thing that was obvious, it's easy. So then I'll show you just 2 slides on the carcinogenic potential. As you may know, the real target seems to be non-Hodgkin lymphoma. That's where the 2 lawsuits are. That's where it looks like glyphosate may have a connection with. And so we reviewed the literature again, and I'll just skip this, but I'll show you the results. So basically, we look at all the studies that were available again on non-Hodgkin lymphoma and exposure to glyphosate. There were previous meta-analyses that showed a 20% increased risk in non-Hodgkin lymphoma. And a significant increase in risk. So what we look at the studies that look at very high level of exposure in workers, and we came up with a higher association. You see is 1.4, means there is a 40% increase in risk of non-Hodgkin lymphoma in workers that are occupationally exposed to glyphosate in farmers. And this, I think, had a lot of, we got a lot of insults for the studies, but that's okay. But I think it's a good piece because if the general association is 1.2, those who are very highly exposed should have a higher risk. And this makes sense with the biological plausibility, as we discussed at the beginning of the session. This is a higher risk than the general population. And I want to close with this slide, which is, you don't have to read all the details, but you see on your left, it's the amount of glyphosate used in the US has steadily increased over time. And here you see the colored rectangular are the studies that have been conducted. So there are 2 messages here that I think it's important. The studies are very few, but like 5 or 6 studies, and they stopped way before the use of glyphosate became really widespread. So those studies, despite the fact we found an association of 40% increase in cancer risk, they're not really reflecting the exposure that is happening from 2010 onward, because they are all very, very old. So there's nothing happening in the most recent years. And I think I'm stopping here. I think I'm on time, right? 1 minute. Okay, thank you.